Hey, what's up everybody? Today I'm talking to those of you that are either planning on getting a knee replacement yourself or know someone who's about to get one. So if you've heard anything about the surgery, then you've definitely heard the horror stories and you've heard how painful that rehab after surgery can be. One of the reasons why that rehab is so painful is because people don't take the time to rehab before their surgery, something that we like to call prehab. So I'm going to show you 3 things today that I guarantee if you do these anytime before your surgery, you're going to have less pain, more mobility, and you're going to fly through those initial stages fast and get back to your regular life, which is obviously why you're getting the surgery in the first place. So the first thing that I would recommend doing is trying to get as much bending and straightening of the knee as you can. So obviously you're limited, that's why you're going in to get the knee replacement. So I would expect it to be a little uncomfortable at either of the end ranges. That being said, if you push it a little bit before surgery, and I'm not saying to go into an excruciating, uncomfortable position, but just a little bit beyond what you would normally push to bend or to straighten, it's gonna make getting that mobility after surgery so much easier. The second thing you wanna do is get control of that quadricep muscle. So the muscle from above the knee to just below the hip. When you straighten out your leg and you squeeze that muscle, that's gonna contract the quadricep and that's gonna teach that muscle to hold the knee straight. Okay, and the first thing that we do after surgery, no matter what, is always try to get that extension back to 0. So always trying to get your leg back to straight. If you practice working those quads now and you teach the muscle how to fire properly, it's gonna retrain that muscle and it's gonna be so much easier to gain control back after surgery. So if you straighten out your leg from a seated position and that leg starts to come up straight, if you touch your thigh, you should be able to feel that muscle contract into your hand. Okay, and if your affected side really isn't strong or you're not sure how to do it, try it with your unaffected side. And if you do them both at the same time, there's actually some carryover that helps to initiate the muscles on your affected side. The third thing is just getting as much flexibility as possible. So we talked about mobility, which is bending or straightening the knee. But in order to get flexibility of the muscles that surround the knee, then you have to be able to put them into a little bit of a stretch. The muscles behind the knee, specifically the hamstring, the gastroc, and the soleus, are 3 things that you want to make sure have as much mobility and pliability as possible so that when you try to gain that extension after surgery, you're not restricted from the muscles and the capsule, but more or less just the capsule. So if you do these 3 things before your knee surgery, which is gain mobility as much as you can in flexion and extension, get control of your quadricep muscle, the muscle right above the knee, and then gain flexibility of the muscles behind the knee, I promise your rehab is gonna go so much smoother and you won't be the next horror story of the rehab after a knee replacement.